Good morning, everyone. I'm Dottie, Reese, and I have the privilege of serving on the LCMC Health System Board. I'm honored to be your moderator for today's panel discussion. Thank you for being here for this important conversation about the future of healthcare in Louisiana and beyond. 20 years ago, when Hurricane Katrina struck, it didn't just upend lives and homes, it dismantled the healthcare infrastructure of an entire region. Hospitals closed, clinics disappeared, and access to care was simply gone overnight. In the wake of Katrina, Louisiana's healthcare system was fundamentally disrupted. And what followed wasn't just a recovery, it was a reinvention. At the time, I was serving on the LSU Board of Supervisors, and I had a front row seat to the collapse of our public hospital system. But out of that crisis came opportunity, the chance to rebuild stronger, smarter, and more community-driven. And this is where the story of LCMC begins. This panel will bring together voices who have each played a role in that transformation. They are leaders, providers, and advocates whose perspectives connect the past, the present, and future of healthcare of our state. I'm excited to introduce the panelists, but first, I would like to thank John Georges of The Advocate for hosting us today. Let's give him a round. Our panelists, Greg Feirn, CEO of LCMC Health. After 11 years in leadership at then Children's Hospital New Orleans, now Manning Family Children's, Greg focused his efforts on building a health system that could truly serve the diverse needs of the New Orleans community. LCMC Health was established in 2009 and has now grown into an 8-hospital system, 3 of which are academic medical centers in partnership with LSU and Tulane. As CEO, Greg provides strategic leadership to advance the system's mission of health, care, and education beyond extraordinary. Dr. Takeisha Davis, CEO of New Orleans East Hospital. Dr. Davis, a New Orleans native who has dedicated herself to the health and well-being of our community. She served at the Louisiana Department of Health and Hospitals for 10 years before joining the LCMC family as CEO of New Orleans East Hospital. Leading this hospital for New Orleans' largest neighborhood, she has extensive experience in clinical care, community engagement, and healthcare systems management. Dr. Peter W., physician at University Medical Center with affiliations at LSU and Tulane. Dr. W. has been practicing medicine in New Orleans for 37 years and counting, holding numerous leadership roles throughout his career. Dr. W. was working at Charity Hospital when Katrina hit, and he has played an integral role in the continuation of healthcare services in the aftermath of the storm and the rebuilding of our healthcare landscape. Today, he continues the spirit of charity serving at UMC. Lou Fregoso, CEO of Manning Family Children's Hospital. Having joined the LCMC family 6 years ago, Lou Fregoso now serves as the president and CEO of Manning Family Children's. In his role, Lou is responsible for maintaining and strengthening children's position as the trusted leader in pediatric health care for Louisiana and the entire Gulf South region. He has been instrumental in the expansion of programs at Children's, the recruitment and retention of top-tier talent, as well as improved access and experience. Ladies and gentlemen, our panel. So we're going to get started. And Greg, I'd like to start with you. I'd like to hear more about the state of health care after Hurricane Katrina.
Sure, Dottie, thank you. Hurricane Katrina, as we all know, completely changed the healthcare landscape in the greater New Orleans area. When you think about what happened after the storm, a number of hospitals closed. You had Charity Hospital that closed, Lindy Boggs closed, never reopened. Children's Hospital closed its doors for 40 days. You could have never imagined closing a children's hospital. Truro Infirmary closed for 28 days. Baptist, which is now Ochsner Baptist, really that closed and really didn't get back into operation until late 2008, early 2009. Methodist out in New Orleans East closed, and it was 9 years before they had a healthcare provider hospital out in that region. So it completely devastated the healthcare landscape, which in a way forced consolidation in this region probably more rapidly than it was happening around the country. Healthcare has been consolidating for the last 20 years, but I think the greater New Orleans area was sort of pushed into it pretty rapidly because of the access that was eliminated post-Katrina. What you had with the closure of Charity and other facilities is the indigent population was displaced and had to gain access to care at hospitals that traditionally didn't treat a large population of indigent. And so the reimbursement dollars weren't following the patients at that time, which caused financial hardship on all of the hospitals in the greater New Orleans area. At the time, some hospitals just had the financial wherewithal and the balance sheet strength to sort of withstand that indigent population. Many didn't, which forced hospitals to begin to look for a partner. And really that was with Children's Hospital. It began with Truro Infirmary in 2009. We started that partnership. And really it was an extension of our mission. At Children's, we had always had as part of our mission to care for all, regardless of their ability to pay. We knew that Truro was important to the community at that time. We wanted Truro to be there for the long term. It was an important facility, Children's Hospital, and Children's at the time had the financial wherewithal to form that partnership, and that was the birth of LCMC Health. And we've held that part of our mission is across all of our facilities. While it started at Children's Hospital, and we were unique at the time, Dottie, and there was really not an example across the country where an independent children's hospital started and formed an adult healthcare system. And adult care now dominates LCMC Health. Certainly we have the strength of Children's Hospital, but it's probably a fourth of our revenue. But the mission has stayed the same, and that is to care for a community and a broader community, regardless of that community's ability to pay. And so that was LCMC Health. It started really our growth and expansion, but it all was born out of taking care of a community.
All right. Thank you, Greg. You shared information about the state of healthcare after Hurricane Katrina, and you actually mentioned financial hardships. But what were and you mentioned the key drivers behind the formation of LCMC and the vision for the new healthcare system. But given that, how did that differ from other healthcare systems at the time?
Yeah, I think it related to consolidation. Then you were starting to see larger systems form across the country, especially through on the nonprofit side, and even those hospitals that were county or parish-owned facilities. Because of just the changing healthcare landscape across the country, it was accelerated in New Orleans. Just cost pressure, revenue not keeping up, etc. So that drove consolidation in the greater New Orleans area, I think, more rapidly than you were seeing it across the country. And again, what was unique for us is it was Children's Hospital was playing a part in that consolidation, where that hadn't happened anywhere in the country, nor were there examples of it starting to happen. Generally, when you look across the country, the standalone children's hospitals are still standalone. They haven't partnered or built larger healthcare systems. What I think necessitated it for us at the time was you were seeing consolidation through Ochsner and its growth of its network. We knew at the time we needed to grow our network, maintain our referral lines, et cetera. So there was, in some ways, it was an offensive play, but also defensive.
Okay, thank you. Dr. W., in what ways did Hurricane Katrina change the landscape of healthcare in New Orleans, both immediately and long term?
So great question, but immediately it was a horrific change to the landscape, both from a patient care standpoint as well as a training standpoint. Both medical schools relied heavily upon Charity Hospital and its system of clinics to provide training for the next generation of providers. And within the space of a week, that was completely destroyed, as were our partners in education across the city. And so this shifted where our learners went, in some cases to Baton Rouge, in some cases to Houston, in some cases beyond that scope, which hurt not just our patients, but it hurt our pipeline for future providers who would then serve the community.
Dr. Davis, Dr. W talked about the change being related to patient care and training. But I'd like to ask you, what were some of the most critical lessons learned from the healthcare response during and after the storm?
Thank you for the question. As Dr. W mentioned, training and care was transformed because of Hurricane Katrina. But we have to think about the landscape that we went into Hurricane Katrina with our healthcare system. It was already a very fragile healthcare system. It was disjointed and not coordinated. We had individual siloed care for those who were underserved. No matter where you lived in the city, there really was only one place for you to go, which was Big Charity. The infrastructure for Big Charity and many of the other facilities was not up to par, state of the art, even though we had state of the art education and teaching happening within those four walls. And so when Hurricane Katrina came, there were many lessons that we learned from seeing our community members who were in most need on top of roofs and in waist deep water. The first was that we are truly all in this together. And that's one of LCMC Health's mottos. There was not one single hospital or one hospital system that could respond to that sort of crisis on its own. So we had to do things differently and work together. And as Greg said, not just consolidate care in the area, but think about the importance of the care outside of the facilities, the buildings. As a New Orleans native, we knew Big Charity where it was. We knew where Methodist was. We knew where Lindy Boggs was. We thought about our health care with respect to those facilities, where those facilities were gone, but there was still a need to care for people. So I think that was the second biggest lesson, that healthcare had to be about people and meeting them where they are. And whether that was in a tent, trailer, on the street corner, we needed to be able to provide the necessary care. The third lesson I think that we all have learned is that we can't just focus on acute care downstream, and that we have to make sure that we're focused on those things that led to some of the very vivid disparities that were shown during the aftermath of Hurricane Katrina, which was that we did have inequities, not just in access to care, but in the way in which certain community members were able to receive quality care. So focusing on prevention, on access, on equity, which we have done for LCMC, I think was a big lesson that we learned.
Thank you. Greg, Dr. Davis really mentioned about hospitals operating in as independent operators in a very siloed capacity. As healthcare has evolved since then, how has LCMC Health evolved since its inception, and what milestones have shaped its mission and growth?
Well, so we've since our inception, I mentioned our partnership with Turo Infirmary, we've devolved significantly. We're now 8 hospitals in the greater New Orleans area. We partner with both Tulane and LSU, and we've grown that partnership over time. As I think about that journey and that path, one of the more, I think, vivid memories is watching the state build the new University Medical Center, the replacement facility for Charity Hospital. And at the same time, the state was realizing budget deficits, et cetera, and putting through massive cuts to healthcare, some that were significantly impacting our academic partners in LSU. And so you're cutting healthcare on one side and you're building this magnificent facility on the other side, and didn't make a whole lot of sense. And that was the step where we said, well, hold up, let's talk state of Louisiana. Let's envision this differently. Let's not reduce care on the LSU faculty's side at the same time you're building a facility that you want to be successful. That started a partnership at Turo with OBGYN. And from there, we continued to grow. We more recently partnered with East Jeff and then Tulane. But now 8 hospitals strong, annually over 300,000 ER visits, 60,000 surgeries, 450,000 inpatient days of care, and an integrated healthcare system, one that's all on the same medical record. Light years ahead of where we were 20 years ago. In fact, it's, in some ways it moved so rapidly, it's hard to believe that we're 20 years removed from Hurricane Katrina. But I think what makes us so special is our mission, what we do for the community, and the fact that every one of our 16,000 plus employees are behind every step of the way, and 100% for this community. So we're a lot of disparate independent hospitals are now part of one healthcare system, working together to care for the community.
It is hard to believe that we're 20 years out, but we certainly are, and we are here today strong as ever. As you talked about the academic medical center, Dr. W., I want to ask you, how is LCMC Health tapping into its academic partnerships and research to shape the future of healthcare?
So the public-private partnership stabilized things from a clinical standpoint, and in turn that stabilizes the academic missions of both medical schools, both Tulane and LSU, creating the type of stability that allows scientists to invest and to recruit the best and the brightest to our area. And so that you can see it today, whether it's at Children's Hospital, whether it's at East Jefferson Hospital, or at the University Medical Center, where we're embracing research and changing the practice of medicine for years to come, to include the Cancer Institute, the NCI designation with LSU, and the promise of that for our community. So it's at one level, we're providing for the patients. At a second level, we're offering cutting edge technology as well as science in the care of those patients, and then growing that not just locally, not just regionally, but nationally.
I like hearing that, locally, regionally, and nationally. And with that being said, Manning Family Children's plays such an integral part in healthcare in this entire region. And so, Lou, I'd like you to tell us, what does the data really say about the health needs of children in our region, and how is Manning Family Children's responding to that?
Well, thank you, Dottie, and good morning. Good morning, everyone. What does the data tell us? I think it tells us that it's really tough to be a kid in our state and our city, and that it's going to require a different kind of children's hospital, one that's willing to run towards the problems that impact our kids. The problems that impact the kids of our community need to become our problems, and that's exactly what we do. If you think about behavioral health, Behavioral health is a crisis in this country. 1 in 5 kids suffer from a mental health disorder. That's 20%. I mean, that's 200,000 kids in Louisiana. And what LCMC Health has done and Manning Family Children's, we built one of the largest and most comprehensive behavioral health programs in the country right here in New Orleans, right here in your children's hospital. We built a 51-bed behavioral health hospital dedicated just for kids, the second largest in the country. But we didn't stop with the inpatient, because what happens when they get out? You need them not to come back in. And so we doubled down, and we're across 200 schools, partnering with the city, partnering with Orleans Parish, Jefferson Parish, to be across 200 schools with nurses and social workers dedicated to behavioral health. We did 17,000 mental health consults directly in schools. They didn't have to schedule an appointment. We went to where kids are at. That is how you change the health of a generation, by being where kids are at, but not waiting and being episodic, but by being, Dottie started off with what LCMC Health has done in terms of being community oriented. That's it. Like, that's how you change healthcare, is by lifting up your community, because it takes a community to raise a child. That's the reality. And some of the other problems that are impacting our kids, suicide is the second leading cause of death. Gun violence is the #1 leading cause of death. And we're out there right now with gun violence prevention programs in partnership with the city, being led by Jenna Bagno and Dr. Fabian Gray, where we're giving away biometric gun safes to any family that has a child and an unsecured handgun in the house. Like, that's being transformational. That's taking care of your community, so then we don't see kids in the ER that have been shot or accidentally shot. Suicide. We've started suicide prevention programs in all of those schools directly where kids are at. We know that we're making a difference, that we're saving lives. But it starts with lifting up your community, and that is LCMC Health's charge. It's not just about what happens inside the hospital. It's how do you lift up your community, lift up the health of your community, because that is how you will then change the health of a generation.
Thank you. As you talked about the importance of integrating or the integration of health and community, Dr. Davis, how is LCMC Health collaborating with partners to meet the changing needs of underserved communities?
LCMC Health, as you just heard Lou discuss, has doubled down on the priority of partnership and making sure that we aren't just providers of care, but we are partners of care with our community. That means that we first have to listen. Healthcare has historically been very patriarchal. And as a physician myself, we're taught that we know things more than those who are not physicians. But what we don't know without listening is what the needs are of our community members every day. And so having community advisory boards at our facilities like we do at New Orleans East Hospital, where the community can come in and tell us what their needs are. They can hold us accountable to the programs and the priorities that we have, and that we work together to transform those communities, and then have innovative programs like Thrive Kids, our community health worker program at New Orleans East Hospital, where we are going out into communities, those mobile units, which are important because many health systems provide screenings and health fairs. I think LCMC Health is unique in that when we are going into communities, we are creating partnerships for access. And so not just screening our community members, but getting them connected to their primary care and specialty care visits that we know are so important to helping to combat some of the disparities that we see. But even further than that, thinking about what are the underlying social determinants of care and that are impacting our community members. And so Lou talked about gun violence, but food insecurity. LCMC Health is working on programs with partners on food insecurity, working with our faith-based providers on health literacy programs, which is so important that our community members who come into our facilities, that we intersect out at our outreach events, understand the instructions and education that we're giving them. And then last but not least, that education. We are leaders in educating the future of healthcare. We should also be leaders of educating our community members on what they can be doing every day in keeping themselves healthy. And so we work very hard to provide that access, education, and that collaboration with our community at LCMC Health.
Thank you so much. I want to come back to you, Lou. You certainly talked about the importance of the integration of health and community. Um, but I would like to know, how is Manning Family Children's reimagining the care experience to better support not just the patients that you're serving, but the community as a whole? And you did touch on some of that as you talked about the building of the behavioral health clinic and the significance of involving the family. But if you could just elaborate on just reimagining the overall experience related to the community.
Yeah, thanks, Dottie. And well, you heard Dr. Davis said it's about community. It's about taking our compassion and our care outside the four walls of a hospital. She mentioned our Thrive Kids program. You know, another way that we do this, and actually a lot of people don't know that we do this, is we're in the JJIC, Juvenile Justice Intervention Center. These are kids that have had a set of bad influencers, and they made a bad choice, and now they're paying their debt. But they're still kids. And our approach is we're not passing judgment on them because they made a bad choice. We're there providing them behavioral health, primary care, dental, the most health care they've ever received, and schooling, all in partnership with the city, in partnership with LSU and Tulane. So when these kids get out, they've got a chance. We want to give them a positive set of influencers. And I think that's, again, something that's very unique about LCMC Health, is we're there for these kids. We didn't pass judgment. They're still a kid. And I'll give you a story. I went there and I was rounding with our team, and I met one of these kids. And if you didn't know you were essentially in a jail and you were talking to this kid, he's just a normal kid now. He's got a set of positive influencers. His name was Aldrich. I said, Aldrich, what are you going to do when you get out of here? He goes, I'm going to be a social worker. Miss Adams, who was a social worker, she got me on the right path. I'm going to honor that. That's what LCMC Health is doing. We haven't turned our backs on these kids because they made a bad decision, because they're poor, because they don't have insurance. They're still a kid, and we're still there. It's our community, and we want them to make a better choice when they leave. And I think one other thing that I can just speak to, again, another population that sometimes is forgotten, kids that have suffered from abuse or human trafficking. These are kids that have suffered unimaginable harm. And your children's hospital built a brand new center that's dedicated to helping these kids. There's 2,500 of these kids every year that suffer this. And we are there standing in the gap for these kids. Because it's not a 15-minute visit or a 30-minute visit. These are years worth of trying to fix the human spirit because of what they've gone through. And that's what LCMC Health, Manning Family Children's, is doing out there in the community, because it's our community.
Thank you. And Dr. W., you're very involved in medical education, and Dr. Davis actually talked about the importance of teaching patients about health education as it relates to self. So what role does education play in empowering individuals to make informed decisions about their health? And how can we enhance educational efforts in this area?
Those are great questions. And I would just say, not for me, without me. And so if we're not engaging our community in where they are, we can't bring them along for their health care. It is their health care. So if I speak to you from a paternalistic fashion that Dr. Davis mentioned, the likelihood of you getting on board with the important things that you need to do to change your health, it's not going to happen. If I then train providers how to meet patients where they are and simply open up their hearts and minds to the patients and ask them what their understanding is in a non-threatening manner, then you have a roadmap. And that roadmap can help reach out to those patients and engage them in healthcare that they're willing to accept. That, along with one of the best programs that exists within the state, the only one of its kind in the States, the Seeds of NOLA, UMC's Trauma Recovery Center, meets our patients where they are to educate them about their own behavioral health challenges associated with trauma, whether it's a physical trauma, a sexual trauma, abusive trauma, or psychological trauma. It helps gear our patients from where they are and gives them a roadmap for their health care, their entire health care.
Thank you very much for that. Lou, you did talk about and gave us an excellent example of how Manning's Family Children's has reimagined healthcare. So thank you so much for that perspective, as well as you, Dr. W, as you really talked about education and patients empowering themselves. But Dr. Davis, if you can give us some insight on how can healthcare organizations also build capacity to better serve communities that face disparities and inequities. We talked about ways where our system is addressing trauma issues, but some of the other insights you may have.
I think we first, those healthcare systems have to recognize and acknowledge, like LCMC Health has, that there's a lot more that we need to do. We have a 25-year life expectancy difference between Black and white New Orleanians. That should be unacceptable to all of us. At LCMC Health, we recognize that and have put intentional investment into programs in our communities to be able to address that disparity in life expectancy. But that comes through partnerships. And so those partnerships, as we've heard, not only with our academic partners, but with nonprofits, faith-based organizations, our governmental partners, are extremely important to helping us to address the social determinants of health. We can't do it alone, nor should we try. If we are truly thinking about how our community works, then it means that we need to be present with those partners in our community. And we think about how important that is to all of us 20 years after Hurricane Katrina. That's how we build trust with our community members. I can remember personally after our healthcare infrastructure was devastated, listening to family members, church members talk about how were we going to come back? What was it going to look like? How would we have healthcare without charity, without Methodists? And now we have beautiful new state-of-the-art facilities, but they're more than just beautiful buildings. They're filled with providers and programs that we have intentionally brought forth that not just focus on healthcare, but care about the health of people. And so we have to do a better job of making sure that our community members know that they are in partnership with us, that we are willing to be transformational and continue to grow care there. And I think that's how we will start to see improved outcomes with disparities. As Dr. W said, we cannot have these programs without the community's involvement, and LCMC Health has demonstrated that we are willing to be present, to be transformational, and have leadership that can be held accountable. So that when we do need to pivot, and we get that a lot in New Orleans East, that, we might think we have great programs, but in partnership with our community, they let us know, well, maybe it's not so great, or maybe that's not what we need right now. And that is why I feel like we will continue to be able to tackle these disparities and hopefully see a decrease in that life expectancy gap.
Thank you so much. 25-year mortality disparity, life expectancy is significant.
Unacceptable.
Yeah. So thank you for sharing that. And which really takes us to really look ahead. How do we address these things? So Greg, to you, as we look ahead, how are local healthcare systems planning for sustainability and access in the face of ongoing economic and public health challenges? Because what Dr. Davis talked about, certainly, Dr. W and Lou are all public health challenges. So, what can we expect? What are we looking at?
Sure, Dottie. A week or even a day in healthcare is a day in healthcare. It's constantly evolving and changing, and we know, and we most recently went through it. There's a constant pressure, just nationally, on how do we manage the cost of healthcare. You have to be innovative. You have to be willing to partner And in some ways, when you do good things, people recognize it, and those good things turn into a revenue stream that helps support what uplifts a community. Thrive Kids is an example. You've heard Lou talk about it. But the city has seen the importance of that initiative, what it does for our children, and lo and behold, the city will want to help fund that. So it's another revenue stream. But we need to continue to focus on cost efficiency, innovation, creating alternative revenue streams to be sustainable, just like any healthcare system in this country. I think we're unique in that we look for ways to partner with the community, and being innovative in that way can help us find funding streams that make sense for the community. We need to continue to focus on that highest level of care. We are partnered with LSU and Tulane, so we have their research, the knowledge that they're building, and leveraging that to help our healthcare system, not only in care advancement, but our ability to help grow and recruit the next generation of healthcare professionals. All of that makes us more sustainable. We just celebrated 10 years with the University Medical Center. Great celebration that, in some ways was the result of Hurricane Katrina. You have a facility that matches the expertise of the faculty and physicians in it, and it's providing great care. We have level 1 trauma with a verified burn unit. One of the only ones, I think, from Houston to Tampa. We're in heart and lung transplant now. We're curing sickle cell at Manning Family Children's. All of those things are part of the little something extra. We put in what we do each and every day, but that little something extra goes a long way to making us sustainable.
Absolutely. Thank you, Greg. You used a keyword, innovation. So Lou, I pose to you, what does the future of care look like with all of the new innovation at Manning Family Children's?
Dottie, you just heard Greg say it. I would tell you the future is actually happening right now at your children's hospital. Every year, 80 babies are born with sickle cell disease. And you heard Dr. Takeisha Davis say there's this huge gap in life expectancy for the African American population. Well, that's one of the reasons, because when a child is born with sickle cell disease, they can expect to live 30 years less, be devastated with pain episodes for their entire life. And this year at your children's hospital, medical history was made, because now we are one of a handful of children's hospitals in the country that now has a cure for sickle cell disease. So the future is a child. So what you can expect from LCMC Health is a future where children don't have their lives shortened because they have sickle cell disease. They don't have to live with pain episodes. They can live out their dreams. They can live out their futures. In fact, Daniel, who is our first patient that will be cured of sickle cell disease through this new gene therapy, he's 22 years old. He has lived his life with sickle cell disease, but he also has a dream. And that dream was to become a commercial pilot. And he has completed all of the requirements to become a pilot. But he cannot become a pilot because he has sickle cell disease. But the FAA told him, you can become a pilot if you're cured of sickle cell disease. Well, Daniel will not only be cured of sickle cell disease come next February, he will live out his dream to become a commercial pilot. And that is thanks to your children's hospital, thanks to LCMC Health, thanks to Tulane and LSU who have brought all of this here. That's what's happening. So Dottie, the future is happening right now, and it's going to continue to happen because over the last 5 years, we've recruited over 200 pediatric specialists to Manning Family Children's. No other children's hospital in the country has that track record. We're bringing experts from around the country right here. And in fact, you probably saw it this week. We just recruited Dr. Russell Hirsch from Cincinnati Children's to be the new director of your Children's Hospital's Heart Center. That is a big deal. He was at Cincinnati Children's for 25 years. He's arguably the best pediatric cardiologist in the country, and now he's going to be at your children's hospital here in New Orleans, here at Manning Family Children's, and that is what's happening. So the future, Dottie, we're going to continue to see this type of work, this type of innovation. in partnership with Tulane, in partnership with LSU. These are the types of things we invest in because they're the problems that are impacting our kids, and we're going to make sure that we do something about that life expectancy disparity. And this is one of the ways that we do that.
You all are doing great things. Excuse me, you're doing great things. And as we talked about, and I really like the way you said that the future is happening now. I mean, I love that term. As we look at the future happening now, everything that happens, we really need a workforce to make that come to life. So this is open. This is for anyone. How can healthcare organizations attract a diverse pool of talent to meet the needs of a diverse patient population? Because one thing about New Orleans and this immediate region is that it is diverse. So how do we get that pool of talent? And it's open.
I'll start. So I think what we are doing already at LCMC Health is creating a pipeline of opportunity for a diverse workforce. We are intentional about making sure that all of our facilities, we have training programs, not just for nurses, but for PCTs and other really important healthcare avenues for, especially entry level. For our community members. If we provide opportunity, not only does that help to diversify the workforce, but it infuses with that workforce development economic incentive and development into our community too as partners. So I know we each could talk about what we have at our facilities. At New Orleans East Hospital, we have the partnership with Chamberlain that LCMC Health has. We have partnerships with Southern University of New Orleans. We have partnerships with Delgado for training for PCTs, et cetera. So I think that's the way that we continue to diversify our workforce and frankly provide opportunity to our community members so that our workforce looks like our community.
Great, thank you.
I would add to that, when you do the right thing and when you do the right thing for a community, people want to be part of it. When you're innovative, people want to be part of it. The example is Russell Hurst coming from Cincinnati Children's. We have the luxury of being partnering with LSU and Tulane and virtually any other academic facility in the greater New Orleans area. So we have the luxury of growing and training that next generation of healthcare professionals that then can be part of LCMC Health. So, we're proud of what we're doing. We have a massive workforce, 16,000 people that are proud of what they're doing. And when people hear about it, they want to be part of it. And that helps grow not our workforce, but the community. So it's exciting to see what has happened over the last 20 years. It's exciting to be part of LCMC Health and really a key part of building this community for the future.
Well, you are doing great things at LCMC Health, and you have so much to be proud of. And I want to thank you all for this very informative discussion. You all, let's give them a round. This past hour has just been both enlightening and inspiring, and we've reflected on how far we've come, honored the challenges we've surmounted, and we celebrated the innovation that continues to move us forward. Our healthcare system has deep roots in this community, and that legacy carries with it both pride and responsibility to ensure access, equity, and excellence for the future. And to recognize the significance of this work, it is my honor to welcome Kyle France, who will present a proclamation from the governor's office.
Yes. Hello, Greg. Let me take a moment of personal privilege, if you don't mind, Greg. I don't know how many years ago, I was honored to serve on the board, Lou, of Manning Children's Hospital. And as a board member, I was one of the votees that voted on the Turo Children's Hospital Partnership. And here we stand how many years later with this new family of hospitals that has grown from that. I couldn't be prouder. LCMC Health is in my DNA. My youngest daughter happens to be a nurse at UMC. I'm very proud of that as well. So it's a wonderful privilege to continue to work with LCMC as well. Secondly, I wanted to also comment that LCMC Health and NOLA.com has partnered with probably the premier meteorologist in the city, Damon Singleton, to do a morning weathercast on NOLA.com. So, Wake Up NOLA. So you all might want to check that out. Here we are in hurricane season.
Yes.
Damon will keep us all informed. But without further ado, Greg, I wanted to present this proclamation from the governor recognizing LCMC's impact on health in and around New Orleans and what we continue to do with employing people here in the city and making a transformational difference on healthcare for our citizens. So thank you, Greg.
Thank you, Kyle. What's that?
They say it's on.
Y'all can hear me?
Yeah.
Thank you, Kyle. And you know, the proclamation, it is a result of our physicians, our faculty members, our frontline caregivers, our leadership. It's what they do each and every day that makes us special, and that gets us recognized from folks at the highest level, like the governor. So I appreciate it, and I appreciate what our team members do each and every day. Thank you, Kyle.
And I'd like to open the floor for questions. We have a Q&A. Mr. Burns. Do we have a,
He wants the secret.
okay, well, Ronnie, wait, we have a microphone.
Good morning. Good morning.
Good morning. This is Mr. Ronnie Burns, chair of New Orleans East Hospital.
Thank y'all very much. Good morning.
So
It's us.
So I have the
Yes.
I have the pleasure of serving as chair of the New Orleans East Hospital Board, and I want to get up here. I know we're talking about LCMC. Greg, stand up for a second. You know, we talking about what happened after Hurricane Katrina.
Yes.
Dr. Davis talked about the devastation in New Orleans East, and we had two hospitals, and both of them were destroyed. We started off as a board to try to rebuild healthcare back in New Orleans. So we were kind of making the rounds to see who we could purchase services for. We met with Greg Feirn, and I've said this a million times, so I'm not making this up right now. Greg stepped up immediately. We were trying to see what we could purchase. He said, I want to be your partner. I want to be your full-time partner, your financial partner. We're going to be with y'all every step of the way. So as we talk about the development of LCMC, Greg, I want to personally thank you again, as I do on many occasions, to thank you for your commitment, your vision, and just everything that you're doing, because we would not have the kind of healthcare we have in New Orleans East if it wasn't out for you and LCMC. So thank you, sir.
Yes.
Thanks, Ronnie. As I mentioned earlier in the program, New Orleans East was without healthcare for 9 years. So to be part of that partnership and bring back healthcare to a community that prior to Katrina had 2 hospitals, it made a whole lot of sense, and it was clearly just part of our mission. So.
Do we have time for one more? Okay. We have time for another question. All right. Well, with that, I want to thank you again, and especially to our panelists for sharing all of your expertise, your insights, and your vision. And for all of you for taking time to join us this morning. What we've heard today reinforces a simple truth that healthcare is not just about hospitals, it's about people. It's about resilience and progress. And since Hurricane Katrina, healthcare has been a cornerstone of this city's recovery and growth. And today it continues to fuel not only healing, but also education, equity, economic stability, and opportunity. So together with the dedication of our leaders, providers, and community at LCMC, we are shaping a system that doesn't just treat illness, it builds wellness and strength for the future. Thank you again for joining us and for your continued support of the health and well-being of our community.